And Evan's going to be talking about two programs. Again, when we talk about what you're hearing about today, these are programs that people have expressed interest in learning more about all across the state. So Evan's going to be talking to us about Baltimore City's Needle Exchange program. We're going to give him some time to talk about that, ask questions, and then we're going to give him a little bit more time to talk about their rapid spike detection and alerting system they have in place. So welcome, Evan. Thanks for joining us.
Thanks so much, Bridge. Oh, I don't have any slides.
No slides. You're good to go. Make it easy.
Afternoon. I am here on behalf of our Health Commissioner, Dr. Lena Wen, and as Bert said, I'm going to talk about two programs. So first I'm going to talk about our Needle Exchange program, then I'm going to talk about our Overdose Spike Response program. So our Needle Exchange program is more than 20 years old at this point. It was started in '94, and today it serves two main functions. The first is to prevent STI transmission among people who inject drugs. And the second is to prevent overdose. It's a mobile program, so we have 3 needle exchange vans. They travel to 14 sites across the city, a total of 28 times every week. This year so far, we've had about 4,000 unique clients. So let me start with the first goal, preventing STI transmission and HIV transmission in particular. We're really excited that other counties and the state more broadly are exploring starting their own needle exchange programs. I think if there was a one-sentence explanation of the necessity of syringe services, it would be this. In '94, when we started our program, 64% of all new HIV diagnoses came from IV drug use. 64%. Last year, the number was 8%. That's the effect that our needle exchange program has had. Of course, the core of that work comes through distributing clean needles. So far this year, we've distributed about 1.4 million. And I should say that number is dramatically higher than it was just a few years ago because of the change in state law allowing for distribution as opposed to a mere one-for-one exchange. That said, we do get a lot of used needles back. We've gotten about 1.2 million syringes back this year. We also have HIV testing available on the vans and soon Hep C testing as well. I said the second goal of our needle exchange program was to prevent overdose death. About 10 years after our needle exchange program started, so in 2004, Baltimore City started its naloxone distribution program, which was then called Staying Alive. This program was expanded dramatically 2 years ago in 2015 under the leadership of our then new health commissioner, Dr. Wen. Since then, since 2015, we've trained 30,000 of our residents to use naloxone. Those residents have reported to us 1,500 reversals. More than 1,500 reversals as of today. And again, that's not including any of our first responders, that's just our residents. Of course, naloxone is expensive, more expensive than it used to be, and we have not come close to reaching a saturation point, which means that we triage. We focus on our highest risk residents, and that of course includes our needle exchange clients. So a lot of our naloxone work runs through our needle exchange program. We've distributed about 7,000 kits this year just through the needle exchange program. Most of those, but not all, have gone to our clients. And those clients have reported to us nearly 800 reversals just this year, January through November. Of course, we understand that naloxone is not the only answer, and so treatment referrals are also available for anyone who is ready to get help. We've referred more than 100 of our clients this year. We have guaranteed slots at providers across the city so that we can guarantee that we can get them in the door. We're excited soon to be starting a project through which we'll be able to offer immediate transportation. So if someone says on the van, I want help right now, a peer recovery specialist can drive them to an outpatient medication-assisted treatment provider. And in the same vein, starting in the spring, our safety net clinics, the clinics that we as the health department run, they're actually starting a mobile clinic, a van that's going to follow the needle exchange vans and provide clinical services to our clients. One of those services is going to be treatment is going to be BUP induction, so outpatient MAT, just like with the transportation. And we think that's important. I mean, we want to refer people into standard of care treatment. We know that for most people, outpatient MAT just works better than detox or rehab, so that's what we focus on. I want to stop there, take any questions about needle exchange before talking about our second program.
Sure. Any questions about needle exchange? Everybody's quiet, full stomachs today. Yes. Mm-hmm.
So the question was about whether our clients get a naloxone kit at the same time that they get a clean needle. Not exactly, so it's not as automatic. We don't automatically give everyone who gets a needle a kit. Usually folks will come to us and first they complete a really short form explaining any reversals so that we know what use the naloxone is being put to, and then they'll get a naloxone kit. And it often happens physically a little bit separate, sometimes outside of the van because it's so small. But by and large, yeah, a lot of people, most clients are walking away with clean needles and a naloxone kit, unless they already have one.
Yes, Jessica. So the question is here, is there anybody from Maryland Department of Health who can speak on the expansion of syringe services programs? When Erin walks out, she'll come back. So, that targets on something I know we get contacted all the time. Marion emailed me and I haven't replied yet about targeting efforts. We all do naloxone education. We try to get naloxone and information out to the right people, but frequently the highest risk population isn't necessarily frequently in contact with government, integrated with government systems. Do you feel like your needle exchange has offered you an avenue to really focus on where people with substance use disorders actually are?
Yeah, I think that's a great point, that it's not just that you have a high-risk population who requires syringe services, but also by providing syringe services, it provides you a recurring touch point with that population. And if you have a client-centered approach, which we do, you can build up that trust. And so it's not just any old touch point, it becomes a really powerful opportunity to refer people into treatment and to distribute naloxone to high-risk population.
Put Erin on the spot here, so she was out of the room. The question was raised if somebody could speak on statewide syringe services programs, especially as we look to expanding programs like this to other jurisdictions and incorporating naloxone services with those programs.
Thank you. I'm Erin Haas. I'm in the Behavioral Health Administration at the Maryland Department of Health. I work on the naloxone distribution program, which is called the Overdose Response Program. So I'm working very closely with my colleagues in the Prevention and Health Promotion Administration, specifically Kip Kastner and Andrew Behrle. And so they are leading expansion of syringe services programs statewide. And so our collaboration is focused on integrating naloxone into that and ensuring that it's, from the beginning, a priority of new programs that get established. So does that answer the question?
I think so. Thank you.
Okay, great.
We know that programs like this, as much as it's fantastic to show statistics and evidence and say, in this environment it worked, we also are facing a lot of different realities on the ground in talking to people and changing hearts and minds. We've seen with the impact of this crisis that people are shifting the way that they're thinking about treating substance use disorders. But if you do have interest in investigating whether a syringe service program might be valuable, Erin's team with the naloxone or Andrew and Kip at the state level are happy to help you not just talk about it, but find trusted messengers, people who can speak to people who might be resistant to a program about the actual benefits and talk about syringe services not just as a maintenance program, but as really a pathway to recovery. Thank you, Evan. With that, we'll move on to your second. Thank you, Evan. With that, we'll move on to your second presentation. Baltimore City's rapid detection effort and alerting mechanism. Thank you.
Thanks. So Baltimore City, I think it goes without saying, has been hit particularly hard by the opioid epidemic. As Dr. Jones mentioned, this is a long-standing problem in Baltimore, but it has gotten dramatically worse very recently. Last year we had 700 deaths. It's two of our people every day. If this keeps up, it's going to start affecting our population. And not only that, our EMS reversed more than 7,000 overdoses last year. So there are more than 7,000 non-fatal overdoses just that our EMS knows about. So what we now do is our EMS at the end of every day, they send us all the data on the overdoses they reversed. We crunch the numbers. If there's any census tract, which is sort of like neighborhood sized, that has seen 3 or more non-fatal overdoses that day, we deem that a spike. And we send an outreach team, a response team to that area to do naloxone trainings, dispensing, if we have naloxone available, and then information about referrals into treatment. To Birch's point about, really trying to target the high-risk population. We also try to send an alert out as widely as possible. So we have an email that goes out every time there's a spike to a large group of partners. There's also now a location-based text service. So anyone in the city of Baltimore can very easily, on their phone, sign up to get these texts. You simply say, what part of the city you live in, and then if there is a spike in that region, you'll get a text alerting you.